Thank you, everyone, for joining us. We hope we are live. Still getting used to this live stream. We've been trying to make sure we do at least one per month since the 1st of January when we did our very first one. Occasionally we'll throw an extra one in there. And we did do a bold thing this afternoon and sent a mail out to our entire mailing list, giving them the link, telling them we're going live. So if you're one of those who are joining us for the very first time, we welcome you here. So the plan for tonight, we might have mentioned a topic, just a little topic like healthy aging. We got the idea of this from, we ran a, what do we call it? An alumni reunion at Queenscliff. Everyone who's attended our immersions over the past 6 years was invited to it. And we had 20 people who we all knew well because we'd all spent, at least 5, 6 or 7 days, depending on which immersion they came to. And
up to 21 days if they'd come to 3 immersions.
As one person had. And one of the sessions we ran was on the topic of healthy aging. So we thought we'd just pick out a few of the things that we've been thinking about over the last month. Do you want to?
Yeah. Healthy aging was sort of like one of the main themes of the reunion event. And I guess we started off asking our participants a question that our functional fitness leader, Graham Ellis, would ask people, and that is, if you continue if you maintain your current lifestyle, what will your life look like in 10 years' time? Like, what will your functional capacity be like? And I immediately think I need to do more flexibility, or I won't be able to do it with my shoelaces. And if you're a little bit younger, then you might think, if I do my current physical activity lifestyle, what will it look like in 20 years' time, in 30 years' time? And I think we're all indebted in the field of aging to Dr. Michael Greger's recent book, How Not to Age, where he pulls together a whole lot of the science on aging and lifestyle, particularly the nutrition side of things. We would add, however, that we sometimes find Dr. Michael Greger very reductionist, in terms of, eat this particular herb and this particular fruit and this one here, but this particular pathway. And what we often ask ourselves, compared to what, and what sort of group of people would this same effect? Would this be significant in whole foods, plant-based people eating a diversity of healthy foods? But overall, it was interesting that when he talked about these 11 mechanisms or pathways for aging, the 2 things really stood out, 2 factors. And that was physical activity seemed to benefit every pathway in terms of, slowing down the aging processes. Whereas on the other end of the spectrum, animal protein, higher consumption of animal protein seemed to adversely affect all of these sort of mechanisms and pathways of aging and the chronic diseases that are sometimes associated with aging, but not always just purely a part of aging. And it's interesting in medicine that there's a bit of a la towards eating plants, and I read another book that someone recommended. I'm not really on a anti-aging sort of trajectory, but I read another book on the biology of aging, and the author would say things like calorie restriction seems to help, but how are we going to do calorie restriction and not deprive ourselves? And like the kid at the back in the classroom who has all the answers, in primary school, say, me, I have the answer. Eat whole plant foods, and then you won't need to restrict yourself, and you'll automatically eat less calories. And then the author of this next book sort of added somewhere that, and sort of protein restriction, so certain amino acids in particular. And I thought, Oh yeah, I deal with that just by not eating animal protein foods. So it's just always perplexes me, this la land between what really is good published evidence in plant-based nutrition, and what's happening in the mainstream medicine. Back to our Queenscliff event, talking about muscle and bone. It really is a use it or lose it situation. Um, and it's not really a one-way path. I mean, there's no denying that, with aging, muscles tend to shrink, bone tends to get less dense. But rather than being the sort of one-way street that's often depicted in medicine, it's more like a two-way street, but with the street getting steeper as you get much older. And so, in old age, you can maintain muscle, you can maintain bone, stop it slipping down backwards, but it takes quite a bit of a push to sort of hold it and stop it slipping back down that hill. You can actually increase both bone and muscle, and that takes an even harder push as the older you get to actually improve it.
Not impossible, as I will
No.
attest, because I had a hip replacement a year ago, so I'd lost a little bit of form, and I've spent the last year, concentrating on building muscle, and I think I have.
Yeah,
I think it's noticeable.
So when we talk about this, well, that also brings us to this idea of health span versus lifespan. Lifespan, being your lifespan, but health span being the part of your life when you have enough functional fitness and capacity to sort of be able to engage in things that are meaningful to you. And I guess sort of the things like maintaining the muscle function and other, is part of that we don't want to sort of fall below that line where we can't get out of the chair, or we can't go for a walk in the forest or something. This is the state of frailty, and it really does seem that if we get the nutrition right and we do that physical activity, that we can sort of push our health span out to be not far behind our lifespan. Of course, the current big push in nutrition and the elderly is protein. I mean, where do you look in nutrition without saying protein? And this is really being pushed by meat and dairy industries and the protein supplement industries. And there's this idea, that you have to eat protein straight after exercise, and that the elderly need more protein, and that you need protein to gain muscle. And, well, protein's certainly an essential nutrient. But there's been some work done on this, and there's some recommended protein intakes for humans, and they're not all that high. And then there's some recommendations for athletes. Hey, people, like if you go to the gym, a couple of times a week and you work out regularly, but you're ordinary, fit, lean bod, not an athlete or bodybuilder, you don't need those huge amounts of protein. In fact, even the bodybuilder, full-on strength athletes, only need a moderately increased amount of protein. But then there's all the work that's been done on protein in the elderly. A lot of it from the US, funded by industry, and
the beef industry in particular,
particularly the beef industry, when people like Dr. Michael Greger actually start to look at the research and the evidence, and find that eating more protein beyond the basic needs doesn't actually lessen frailty. In fact, high amounts of animal protein through later life leads to more frailty. And it's been looked at a lot, and they've said, okay, well, let's look at what happens if we get these older people to do some, strength training exercise. And that's been looked at again and again. And it's really good, because it shows that doing more exercise and strength work really does work even in the much older age group. But that adding extra protein to that regime makes little, if no difference. and there's some little bits of information that'll try and fool you, like they might tell you that whey protein increases muscle protein synthesis rapidly, but then what they don't tell you is if you look over a few months on how much muscle gain, strength gain that person has, the short-term effect doesn't translate into a sort of ergonomic effect in the long term, which is what we're interested in. So I guess this sort of brings us to the strength work, and a study that was reported last year, I think are very important because it looked at bone density in middle-aged to older adults, a few hundred of them, predominantly women, who did in an Australian study that looked at strength training. And when I say strength training, like they were strength training, they were sort of doing curls and squats and things that were hard for their current level of fitness. And they found that over a 1-year period, bone density improved significantly, improved at all sites, even the spine, which is we've always been troubled about how to increase the bone density of the spine. Like hips, obvious, you squat up and down on things, but what about the spine? Well, this general weight training program improved that too, which I think then brings us to bone density. And many of you, if you're a female over 50, and we shouldn't neglect the men, but they're often forgotten in this one. Most areas of medicine, we forget the females. But and your doctor will order a DEXA bone density measurement, and the result will come back, and the result will be compared to a reference group. The reference group will be people of European descent, young adults. Average young adults, like they'll have a fairly solid sort of body build. They won't be super light and lean. And you compare yourself with that. And here am I, 65, always been very lean, fairly light. My bone density is going to be less than this group. But unfortunately, when women get this, and I say women because they're mainly the target of the bone density measuring industry and the target of the bone building drug industry, and they get their DEXA result back, and it's like, I've got osteopenia. Osteopenia is like, it's not osteoporosis, but your bone density falls in the lower part of the bell curve for that population of young adults who you don't belong to anyway. And then you might even slip slightly into the osteoporosis range, where it's down to the bottom end of the bell curve for that young population. At that stage, you might be prescribed one of the drugs. These don't work very well. I mean, as a doctor, I would prescribe them maybe to someone with an extremely low bone density, some other pathology causing it, fractures occurring. But generally, I wouldn't.
Fractures without trauma.
Fractures with minimal trauma is the term. So we know from the neuro study, the bone density weight training study and other research that exercise works better. But there's another factor there that we're not just looking at the bone density. You generally don't break bones just by the bones thinning out. Like my wrist is not going to break sitting here. It's usually falls. Falls break bones. Osteoporosis just makes it easier to break, but the falls break bones. And this is where exercise programs have a big lead on any of the drugs, in that you can put people through a fairly short, balance program and reduce fractures fairly quickly. I mean, you also might do other things like take that curled up piece of carpet that you're going to trip over out of the lounge room. But also, the more strength you've got and the more you exercise and move and things, the more agility you have. So when you catch your foot on that curled up bit of carpet in your lounge room, you do a little hop and a skip, and you don't actually fall over. And that's sort of part of that functional fitness, gives you the capacity to do that. So that really takes us a full circle back to physical activity. And I'm a lifestyle medicine practitioner, and although a lot of I give the greatest emphasis to nutrition. Um, the second thing that I give emphasis to after that is the physical activity. And if you were seriously trying to hold back the frailty of old age, then that would usually mean some exercise that's a bit strenuous and requires some strength work, whether that's going to a gym and pushing weights and things, or whether it's functional fitness where you're doing squats and lifting and pushing and pulling things. Is it's a matter of personal choice, but it works, and we can all do it. And I guess a bit of motivation could be coming back to you with your current level of physical activity. What's going to be the long-term result?
And we welcome any questions you have about these topics. Karen's noted that she's had a DEXA last week and been diagnosed with osteoporosis. I'll confess I haven't actually had one. I just assumed, and I made this assumption a couple of years ago, that I would have quite low bone density because I'm light, and so I exercise making that assumption. Maybe one day I'll have a scan.
It's a bit like as older adults, adults who in earlier life, ate a more Western diet. We might assume that we have micro cancers, assume that we have heart disease, and take a nutrition lifestyle approach that sort of is trying to sort of hold these back, assuming it's already there. As far now, I've actually quite embarrassed because I'm sort of I do consider myself a conventional doctor, but I've more often found myself lately advising people, saying to women, "I know, don't have a bone density measurement," because it's going to get you into this into the system, into this treadmill. And someone's asked a question and said, "Been put on Prolia." And that's a drug that sort of inhibits the normal sort of breakdown side of bone, of the remodeling. It doesn't actually build bone, but it stops the body from breaking down or slows down the breakdown of superfluous damaged old bone, because the bone is always being sort of nibbled away by breakdown cells and rebuilt. One unfortunate thing about Prolia is when you stop Prolia, you tend to get a period of more rapid bone loss. So they're now sort of saying, when you stop the 6-monthly Prolia injections, you better go on to one of those bisphosphonate drugs for a period of time to stop that. So like drugs to treat drugs.
So James asked, do you exercise every day? What about building more movement into your daily life, e.g. like Dr. Greger using a treadmill desk? Well, we exercise daily. It varies for me. I'm not quite as active as Malcolm because he does some long runs several days a week. But my routine is a couple of swims, and those swims are between 2.5 and 3 kilometres, and some of it a little bit hard, and 3 days in the gym. And on the other 2 days off, one of them I do Pilates with a physio, guided rehab Pilates, and on the other day, it's usually just a long walk with the dog. There's a walk with the dog every day. What about you?
Yeah, I think, as I've got older, I've realised that it's more important to put in more time in the gym for the strength work. I still run, and I'm an age group athlete. I'm so slow now, Jenny. But no, I've been doing some running training and even a bit of an interval training. And yesterday was a bit of a test run for a 10-kilometre event I've entered. And it was an 8-kilometre time trial round and round the Tan in Melbourne, which is, got a bit of a big hill in it too. And that was pretty hard. But I've worked out from that I could run hard for 10 kilometres.
The question about
what
stopping
do I do?
I
do swimming with Jenny because I used to do triathlon, and Jenny swims twice a week, so I have to swim twice a week. I even have to try and do butterfly because Jenny sometimes swims butterfly. I find swimming quite hard, but I often have some days it sort of grows on me better than others, but Yeah. We spend quite a bit of time in that gym, you know,
So
starting off
I
with a
guess the
good
other
bit of
part of
aerobic.
Jane's question is about, throughout the day.
Throughout the day. Yeah, you know,
Mm.
it doesn't, we sort of like, they talk about physical activity and then the sort of more formal practices like exercise. I mean, I really like exercise and, you know, going to the gym, but some people are no, just let me incorporate it into my life. I think if you're just strolling around on the flat, you're not really going to do all that much for your bones and all that much for your muscle strength. I think if you're seriously trying to maintain bone and muscle, there's going to be a bit of harder work there. You know, I mean, if you're walking up and down steep hills, if you're pushing, pulling, lifting things, that'll certainly count. You know, someone who does a lot of, you know, has a large property and does a lot of sort of maintenance of, you know, like farm work type, gardening work. Yeah.
I think the other thing is look for opportunities in your daily life to turn something into quite a good, movement range. For example, if you're picking something up, think about squatting down, holding your core as you stand up, and think about your form. That's certainly something that I've had to really remind myself. If I'm standing chopping those veggies, I've got to think, Jenny, hold the core in. Just simple things. And if you have a job where you're seated for hours at a time, try and stand up even, within every hour and have a stretch, do something that's, just going to increase that opportunity to move your body in some way. Put a song on your phone and get up and dance to it. Just do something.
And Karen's come back in again about wanting to stop the Prolia. What would I do in that situation? I'd stop the Prolia and I'd hit the gym, mindful that that if you've been on Prolia, for a couple of years or something, then when you stop it, there'll be a sort of period of accelerated bone loss. But you can offset that as good as a drug can by doing strength work during in that 6 to 12 month period after you stop it, to offset that bone loss, and hopefully you'll sort of develop a habit and you'll keep doing that strength work.
And when we say hit the gym, it's like it doesn't mean you have to go into a crowded, noisy, boisterous, male-dominated gym. But maybe if you don't have, or you're not accustomed to doing gym work, seek the expertise of an exercise physiologist. If you have been nursing any injuries, well, work with a physio to be given a range of exercises you can do at home. Maybe build up by buying a stretch band and a couple of weights and things that you can, there's a lot of exercise, as we learned during lockdown times, a lot of things you can do in the home gym. However, my experience with lockdowns when we couldn't go to the gym is that it was all too easy for me to get up in the morning, have a cup of tea, and think, oh yeah, I'll start the home gym in the lounge room, and I wouldn't quite do it. So for me, what works is we have a membership and I've got to go to a gym, and I'm in there, I'm focused, I work hard for an hour, sometimes an hour and 15 minutes, and I get a far better body workout doing that. Work with someone if you're not accustomed to it. As I say, physio, exercise physiologist, personal trainer in the gym. Just bear in mind that you might need something a little more tailored for your needs if you've had any injuries.
But yeah, you might even need it. If it's really complicated, then you might need the guidance of an exercise physiologist who can sort of prescribe something to you. But there's also functional fitness things like our functional fitness person helps us out with the Emotions, Graham Ellis. He does functional fitness classes. Like when we're at the Emotion, he does a workout for us that works my legs and thighs and arms.
No equipment at all.
Abs and things like that. I remember once on the only cruise I went on, the plant-based athlete Robert Cheek ran a sort of morning fitness thing on the deck one day, and I thought, just moving around, no equipment. I cursed him a couple of days later because he managed to devise exercises that stressed and loaded a lot of my muscles, and they got sore. Some people watch video classes. Use YouTube videos that suit them in terms of training.
But you need to build a routine that is sort of, I mean, it can be. I make things non-negotiable within reason. If I was really unwell or had, a really exhausting weekend at one of our events, I might give myself a day off. But otherwise, you need to build something into your program that, like, if for you it's the morning, that nothing interferes with it, which means going to bed early enough so that you can wake up fresh enough in the morning. And if you're someone that is highly motivated to do something at home, yes, there's Jane said there's a Peloton app. So there's lots of things you can tap into.
And someone else has noted that if you've got more complex fitness needs, your GP can do a care plan and refer you to an exercise physiology and ologist, and you get a Medicare rebate for that.
Brenda's asked the name of, it's Graham Ellis, and he has the website Renewed After 50. We'll put that after this live stream. I'll put it in the comments under both. This is the first time we've done live stream directly to Facebook and YouTube, and had followers on both. Now I'm just seeing how it works for the first time. So some of you might not be seeing where these comments are coming from because you're seeing them via Facebook. I think that's how it works.
And you'll need more.
But I'll put it in the comments in both places so that you can. Because Graham, he's based in does some classes, I think, in Glen Iris and Hawthorn in Melbourne, but he also does things via Zoom, so you can tap in into his programs if you like.
And the protein issue will come back. I just say, like, eat enough calories of whole grains and legumes. Like, do you
mean the protein issue when you speak to Graham? Won't be telling you
Graham
more protein.
Won't be telling you. You need to eat enough calories. If you're seriously skinny and underweight, and if you're under eating, and we often see that when people are changing in as they make transition to whole foods, plant based, and it's go and they say, I have a quarter of a cup of oats, and you go, oh, we both have, a cup or more than a cup each.
You have to eat enough.
You have to eat enough. And incidentally, on the oats question, oats don't belong to the protein group in the dietary guidelines, but we just looked up the chart today, and just the oats part of our breakfast, Jenny gets 12 grams of protein, or more than 12, and I get,
and there's protein in the little bit of soy and soy yogurt I have.
You get about 12 grams, and I get about 16 grams of protein just from the oats in our breakfast. So we're easily going to smash those recommended intakes of 0.8 grams per kilogram. According to Greger, it doesn't go up with age. But, some people say, well, maybe it does. Maybe it goes up to from 0.8 grams per kilogram of weight, given this is assuming you're lean. Obese weight doesn't count. But even if it is 1 or slightly over 1, you'll easily smash that. And there's recently been people in the plant-based world who've said, hey, you don't absorb all of the calories of plants. Some of it goes right through you. So you need a bigger protein allowance. Maybe you lose 10%. Actually, the same happens to people on animal-based diets, but to a lesser degree.
But also, it's not just protein that you need more of. So we just need to eat more.
No. If you end up, flushing a small percentage of your calories, because that's just how the gut works when you eat a lot of fiber, then you'll probably eat more, and so you'll get more protein. And it's only quite a small number, like 10% or something.
There's a couple of good suggestions. Judy says, learned a lot from her exercise physiologist and can access via a care plan. So if you have what are they called, the care plans? The
GP
care plan and makes it a little bit cheaper. And Pam says locking in with a personal trainer and paying up front is what works for her. Otherwise, she'd be thinking about it forever. And you need to do something that you're going to be able to stick with. And Peter's asked the question, he's acknowledged he came in late. What are the chances of building up a bit after 60? Well, I said earlier on that yes, you can, because I have. I was losing a little bit of muscle form, particularly around in my legs when my hip was pre-surgery when it was getting quite uncomfortable, and I've got a lot stronger, and I'm so looking forward to hitting those ski slopes in a couple of months and feeling like I'm stronger than I've been for several years.
So sometimes having a goal to
definitely-
work
yeah.
towards can really help. Like after Jenny had a hip replacement last June, the promise of snow skiing was enough of a carrot. And someone else noted that, as a runner, I've noticed this, the Couch to 5K program to help people build up from very little running to being able to run a 5-kilometre run, in gradual steps and bits and pieces, because, muscles adapt, but they don't adapt overnight. So generally any type of change in fitness activity, you need to sort of slowly build into it.
What about an elderly person, 87, struggling to get up out of a chair but does not see the need? Well,
that's a difficult one. I mean, it's like the person's got no intention of changing what they eat. It's like, what am I to do? We can't sort of beat people over the head and make them do it. If they only knew that if they have difficulty getting out of the chair, that if they spent some time each day
it's getting up
rising
and down, up and down,
like every time they get in and out of that chair, go up and down a few times. It doesn't take all that long to get results, and it doesn't matter how old you are. I do think sometimes it's probably challenging to the really frail people because they've got so little muscle there that it's going to take a long time and consistent work before they really go, I've got some muscle now. But the things like rising up and down from a chair, work on that, rising up and down from a chair for a few months, and you'll suddenly be like Jenny's mother was maybe 8 or 10 years ago, where she used to sit on an elevated seat and have a walking frame, and through plant-based nutrition and just a modest amount of physical activity, she managed to toss away that walking frame and
for quite a few years.
For many years.
You were going to mention something about body composition, or are we going to do another one of these around that?
How's the time going?
Well, we've said we'd only go for about half an hour, and so probably not. But,
I actually had a body composition, a DEXA body composition scan last Monday. There were no rude surprises there. I'd known 15 or 20 years earlier that my bone density was on the low end of the scale, and the reading I got I was happy with. But that brings us to the issue of of this sort of skinny fat business where you shame everybody whether they're skinny or fat. But no, seriously, recent studies have shown that body mass index measure, where obesity's 30 and overweight's 25. We've always known that it doesn't really differentiate fat and muscle, but more recently it's become appreciated that as people get older and they lose that muscle through inactivity rather than just age, they can be not at all overweight, totally normal body mass index, weight for height, but the muscles have got very small and the body's now got a lot of fat instead. And so the authors actually suggested moving the threshold to 20 BMI of 27 for adults over 40. And that's where a body composition scan by DEXA, which I think there are some recent restrictions in some states on the DEXA scan. It does involve X-rays, but not very many, not very much. And so I had a DEXA scan, and I was quite pleased because I had 13% body fat. It puts me right off the scale for the trajectory, the normal range trajectory with age. But I'm aware I'm aging, but apparently my proportion of body fat sort of stayed sort of normal for younger lean adult. And then the abdominal fat is really bad to have visceral fat, fat in your belly on the inside around the organs. And I don't know what I would have done if I found that was high, but I was pleased to find that that was very low. And I'd say to people, well, how did that happen? And it's like, well, because I like to work out every day, but probably the big thing is I eat whole plant foods, and I'm not pouring, nut pastes on everything, and so
low
we're
in
at the
fat.
low fat end of
Mm.
the whole foods plant-based spectrums. There's very large amounts of oats, brown rice, potatoes, beans, but we're rather modest on the nuts and seeds, and pretty much not at all with concentrated processed foods like protein powder, vegetable oil, and sugar. So I don't think it was an accident that my body composition turned out like that.
So I think it leaves everyone with the question, like, well, they're discouraging us all rushing off to have a body composition scan.
As early as 2016.
What can all of you take home for this? And I think it's just being aware that you could be of a normal BMI or wherever you are on that spectrum. And, if you've not had a habit of regular exercise and you have a habit of being drawn to the very high fat foods, even in the whole plant food kingdom, that you might be at risk of having, low muscle mass and excess body fat, even if it's not showing. And I think, do we have to rush out and get a scan to tell us that, or can we look at what we're doing and think whether there's maybe some adjustments that we could make to tip the balance? And I think you've often had patients who have, almost bordering, like eating a whole food plant-based diet, but bordering on insulin resistance. And is it the cholesterol that's not shifting?
Well, both really. The cholesterol's not shifting, and and they're not genetic, LDL or 5 type cholesterol, but their cholesterol is just not quite going down, and their HbA1c measure of blood sugar control, of insulin resistance, is just a little bit on the high side. And I suspect that the issue might be the excess of body fat, and particularly that visceral fat. That could be the reason why they're not getting to a really healthy level of cholesterol and of blood sugar control.
It just reminds me of one of my favourite sayings from Dr. Michael Clapper: your body is never not looking. So if you're concerned about any of this, well, you're welcome to chat with us and make an appointment with Malcolm. He's a GP and sees patients right around Australia.
Lifestyle medicine now.
Lifestyle medicine and nutrition and lifestyle. And I run some coaching groups and available for nutrition consultations. And we've got our next immersion in September. It's going to come very quickly. So if you're interested, then please get in touch with us some way through our page, or if you're on our mailing list, reply to me and let me know, because we need to sort out our numbers for that soon. And but I think we should finish now.
Well, I've just remembered a little slogan we came up with in the Pritikin Health Association of South Australia in the late 1980s, and it was like it went something like, "Don't worry about your health, do something." And I think when we think of all these DEXA measurements and other things, it's like, there's not always any benefit in taking measurements. It's the doing that's really important.
So we'll say good night. Got to go and finish cooking our dinner. And we won't always promise to send out a little mail out to a mailing list. We do encourage you, particularly via YouTube, because now that I've worked out how to push this through to YouTube, to follow our YouTube channel so that you get notifications when we set up the next live stream. But we also do this through Facebook as well. So follow us in one of those places and you'll know when we run our next one, which we've no idea, but it'll be somewhere before, within the next month. And
they won't be all the same length. Today's been quite a long one, but we may decide to do a short one. Like recently we've been reading about GMOs in Australia, glyphosate in the Australian food supply. We might do a little short one on that.
Okay, so see you everyone. Thanks for joining us.